Stop whatever you are doing right now and look at your fingernails. Not at your nail polish and not to see whether they need a trim. I mean, truly look at them. Examine the surface, the shape, the ridges, the color at the base, and the way the skin sits around the edges. Most people have never actually looked at their nails in their entire adult life. They have trimmed them, painted them, or maybe bitten them down to nothing during a stressful meeting, but they have never actually read them. That is a problem, because your nails right now may be displaying warning signs that your nervous system, your kidneys, your liver, and your brain have been quietly trying to communicate for months or possibly even years. I am Dr. Franklin. I have spent my career in neurology with a particular focus on how systemic diseases express themselves through the body's peripheral systems, the skin, the extremities, and the nails, long before they ever announce themselves in a dramatic clinical event. I want to share something that surprises most of my patients the first time I say it. Your nails are not cosmetic. They are neurological and metabolic data. After the age of 60, your body's ability to compensate for quiet, internal dysfunction begins to narrow. The biological reserves that kept everything running smoothly in your 40s are thinner now. This is not because something is inherently wrong with aging, but because the biological margin between a quiet struggle and an outright crisis becomes shorter with every passing decade. Within that narrowing window, the nails become one of the few places where the body still leaves a visible, readable trail. Today, I am going to walk you through 4 specific nail appearances that have been linked in published medical research to 4 serious conditions that disproportionately affect adults over 60. These conditions involve the brain, the nervous system, the kidneys, and systemic metabolism. These are not rare diseases. Rather, they are conditions your doctor may not have discussed with you. Not because they are hiding anything, but because a standard 15-minute appointment simply cannot cover everything. The 4th sign is the one I want you to stay for, and I have saved it for last deliberately. It is the one I see most frequently in patients who come to my office after years of suffering from vague, unexplained neurological symptoms like fatigue, mild memory fog, and tingling in the hands. Remarkably, it is the one sign that almost nobody connects to their nails. Before we dive in, I want to ask you a quick question. Drop your age in the comments below and tell me. Have you ever been diagnosed with a vitamin deficiency, a kidney condition, or any kind of neurological issue? Your answer will dictate just how closely you need to pay attention to what I am about to cover. And if this channel is new to you, please take a moment to subscribe right now. The insights we discuss here represent information that belongs in the hands of every adult over 60, rather than hidden behind a medical consultation you have to schedule 3 weeks in advance. Let us get right into it. Here's what most people are never taught about their fingernails. Your nails grow from a structure called the nail matrix, which is a band of living, dividing cells tucked just beneath the base of each nail. Those cells do not live in isolation. They are in constant dialogue with your bloodstream, your peripheral nervous system, and your overall metabolic environment. Every nutrient your body absorbs, every toxin it struggles to clear, and every inflammatory signal traveling through your system must pass through the tissue that feeds your nail matrix. Think of it this way. Your nails function much like a geological record. A cross-section of rock tells geologists exactly what was happening to the Earth hundreds of thousands of years ago. Layer by layer, your nails do something remarkably similar. They grow slowly, at a rate of about 3 millimeters per month. And as they grow, they encode information about what was happening inside your body during that time. For instance, a disruption in your nutrition 3 months ago may show up as a ridge crossing your nail today. A chronic metabolic problem may express itself as a persistent change in nail shape or color that has been building for years. After the age of 60, the peripheral nervous system, the nerves that run from your spinal cord out into your hands and feet, becomes far more vulnerable to the effects of nutritional deficiencies, vascular insufficiency, and systemic inflammation. Because the nail matrix is fed by peripheral vessels and nerve-adjacent tissue, it often reflects distress in those systems long before any other visible symptom appears. Your doctor is not ignoring your nails out of negligence. It is simply that a nail examination is not standard practice as a diagnostic screening tool in a routine primary care visit unless something is visually alarming. The result is that subtle signs that could prompt an earlier investigation go completely unnoticed, sometimes for years. So, let me show you exactly what to look for. We will cover 4 signs, 4 diseases, and 1 test at the very end that you can perform on yourself right now in about 10 seconds. The first sign is longitudinal ridging and its connection to Parkinson's disease risk. This first sign is something most adults over 60 are already seeing on their nails, and they have likely been told it is completely normal aging. These are vertical ridges, lines running from the base of the nail straight up toward the tip. Sometimes they are fine, and other times they are pronounced enough to catch your thumbnail when you run it across. Now, here is the important distinction you need to make. Mild, faint vertical ridging that appears symmetrically across most of your nails after age 60 is, on its own, often just a benign feature of aging. The nail matrix, like every other tissue, simply becomes less efficient at producing a perfectly smooth nail plate as the decades pass. However, there is a specific pattern of vertical ridging that is entirely different, and the difference matters enormously. What I am describing is ridging that is noticeably deeper on one hand than the other, accompanied by a brittleness that worsens progressively over a 12 to 24-month period. Crucially, this appears alongside even subtle changes in finger tremors, handwriting size, or grip strength. This asymmetric pattern of nail deterioration, particularly when it is more pronounced on your dominant hand or paired with other peripheral nerve signals, has appeared in clinical literature in association with early-stage Parkinson's disease. Here is why the neurology is relevant. Parkinson's disease is not primarily a movement disorder at its onset. In its earliest stages, it is actually a disorder of the peripheral and autonomic nervous system. The dopaminergic cells in the substantia nigra, which most people associate with Parkinson's, are not the first cells affected. Research into what is called the prodromal phase of Parkinson's, the period that can precede a formal diagnosis by up to a decade, shows that peripheral autonomic dysfunction, including changes in skin and nail health related to nerve supply, can appear years before any tremor becomes clinically obvious. The autonomic nerves that regulate blood flow and sweat gland activity in your fingertips also contribute directly to the tissue environment of the nail matrix. When those nerve signals become less consistent, as happens in early autonomic dysfunction, nail quality can change in ways that a careful observer will notice. I want to be absolutely clear here. Vertical ridging alone does not mean you have Parkinson's disease. It does not even suggest it when viewed in isolation. What truly matters is the pattern. Look for asymmetric progression combined with handwriting changes, a new tendency to shuffle slightly when walking, any change in your arm swing, or a loss of your sense of smell. A fading sense of smell is actually one of the most reliable early markers of Parkinson's in the prodromal phase, yet it is one that almost no one connects to the disease until much later. I think often about a patient I will call Raymond. He was 67 years old and came to see me initially because his wife had noticed that his handwriting had become significantly smaller over the previous 18 months. When I examined his hands, the ridging on his left thumbnail was dramatically more pronounced than on his right. He mentioned that he had also noticed his left thumbnail seemed to break much more easily than the right, though he had attributed both issues to the simple fact that he was right-handed. Almost as an afterthought, he quietly mentioned that food had not seemed to taste or smell the same for the past year or two. The combination of those specific findings, not any single one of them in isolation, led me to refer him for a detailed neurological evaluation. His early-stage Parkinson's diagnosis came back confirmed. Because we caught it during the prodromal phase, his treatment began at a point where it could meaningfully preserve his quality of life for significantly longer than if we had waited for a more obvious clinical presentation. The practical takeaway here is simple. Look at your thumbnails specifically. Hold both hands side by side under good, natural light. If the ridging pattern looks noticeably different between your left and right thumbnails, write that observation down. Note whether your handwriting has changed size, note whether your sense of smell seems different, and at your next appointment, tell your doctor you want a neurological screen. The second sign involves Bow's lines and kidney disease. This sign often appears suddenly enough that people notice it, but they rarely understand what it is trying to tell them. Look at your nails for horizontal lines or grooves running across the nail, not along the length, but across the width. This looks like a single indented groove pressed into the nail, much like a line pressed into clay. These are called Beau's lines, named after the French physician Joseph Honoré Simon Beau, who first described them in the 1840s. Beau's lines form when a major event disrupts the nail matrix so significantly that it stops producing nail tissue normally for a period of time. When the matrix recovers and begins growing again, the nail moves forward, leaving a distinct groove where the interruption occurred. A single Beau's line appearing on multiple nails simultaneously often follows a major systemic illness, a serious infection, a high fever, or major surgery. If you had COVID 19 in the past 2 years and now notice a distinct groove crossing several of your nails, that is very likely what you are seeing. That specific scenario became so well documented after the pandemic that dermatologists gave it its own informal name, COVID nails. But here's what I need you to understand. Recurring Beau's lines, multiple grooves across the nail at different heights, or grooves that keep reappearing without any obvious underlying illness, tell a completely different story. Recurring Beau's lines in an adult over 60, without a clear episodic illness to explain each groove, have been associated in clinical literature with chronic kidney disease. Here is why. Your kidneys filter waste products from your blood, including metabolic byproducts that become toxic to cells when they accumulate. One of the conditions that develops when kidneys begin to fail is called uremia, which is a buildup of urea and other nitrogen-containing waste products in the bloodstream. These waste products are directly damaging to rapidly dividing cells, and the nail matrix cells divide faster than almost any other tissue in your body. When uremia begins, even at subclinical levels before any dramatic symptoms appear, it stresses the nail matrix enough to repeatedly interrupt normal nail growth. Chronic kidney disease affects a significant percentage of adults over 60, and in its early stages, it is almost entirely asymptomatic. Most people do not know they have early CKD until a routine blood test reveals it. Yet, some of those exact people have been watching grooves reappear on their nails for years, dismissing them as nothing. There is also a second nail sign specifically associated with kidney disease that is worth mentioning here, because it often appears alongside Beau's lines in the same patient. It is called half and half nails, or Lindsay's nails. This occurs when the lower half of the nail appears white or pale, while the upper half, the portion closer to the tip, appears pink or brownish. The line dividing the two colors is usually quite sharp. This pattern has a strong, documented association with chronic renal failure. If you see both Beau's lines and a half and half color pattern on your nails, that combination warrants a very specific conversation with your doctor about your kidney function. A patient I will call Margaret, who was 71 years old, had been noticing a groove crossing her nails on and off for about 3 years. Each time, she assumed she had simply been sick with something she hadn't fully noticed, a mild virus or just a bad week. She was not wrong that something had been stressing her system. What she did not know was that her kidneys had been slowly declining in function since her late 60s. When she eventually came to me for an unrelated neurological complaint, persistent leg cramping and a slight foggy feeling in the mornings. The combination of her nail findings and her symptoms prompted me to order a comprehensive metabolic panel. Her eGFR, the standard measure of kidney filtration rate, was significantly below normal for her age. Early-stage CKD was confirmed. Dietary modifications and careful medication management have since stabilized her kidney function at a level where her prognosis is considerably better than if we had discovered this 2 or 3 years later. The practical takeaway here is to look across the width of your nails, not just along the length. If you see one or more horizontal grooves and you cannot attribute them to a single episode of significant illness, ask your doctor specifically for kidney function blood tests, a basic metabolic panel including creatinine and eGFR. If you also notice a sharp color change between the lower and upper halves of your nail, mention that explicitly and ask about a renal function assessment. If you are still with us and finding this helpful, type the number 2 in the comments so I know you are there. And if you haven't subscribed yet, please do. Your support keeps this channel going. The third sign is spoon nails and the brain-body deficiency connection. This sign connects most directly to neurological health in a way that often surprises people. Look at the shape of your nails from the side. Most nails curve gently downward over the finger, forming a soft arc that follows the natural shape of the fingertip. However, Some nails begin to curve in the opposite direction over time. Instead of curving down, the edges of the nail lift upward and the center becomes concave, resembling a small spoon. If you were to place a tiny drop of water on the nail and it did not roll off, the nail has spooned. This condition is called koilonychia, or spoon nails. In adults over 60, koilonychia is one of the most important nail signs to recognize, not just because of what it indicates about the body, but because of what it means for the brain. Koilonychia is most classically associated with iron deficiency, but the connection most people are never told about is this. Iron deficiency in adults over 60 does not just cause tiredness. It causes neurological symptoms, cognitive symptoms, and memory-related issues. In an older adult, these symptoms are frequently attributed to simply getting older or even to early dementia, when the real cause is a correctable nutritional deficiency. Iron is not just a building block for red blood cells. It is absolutely essential for the synthesis of myelin, the protective sheath that coats your nerve fibers and allows electrical signals to travel through your body at full speed. It is also essential for the production of several key neurotransmitters, including dopamine and serotonin, and it is directly involved in the metabolic function of the frontal lobe, the part of your brain responsible for executive function, memory retrieval, and processing speed. When iron stores fall, which can happen silently in older adults for many reasons, including reduced dietary intake, medication effects on absorption, or subclinical gastrointestinal blood loss. The brain is one of the first organs to suffer. The nails, because they are produced by rapidly dividing cells that are highly sensitive to iron availability, can show structural changes well before the neurological effects become obvious. The specific neurological picture of iron deficiency in an older adult often looks like this: fatigue that is entirely disproportionate to your activity level, difficulty concentrating on things that used to come easily, a sense of mental slowing, and sometimes restless legs at night. That persistent, uncomfortable urge to move your legs when lying still is actually one of the most overlooked symptoms of iron-related neurological stress. If your nails have been gradually becoming more concave, with the edges lifting and the center hollowing out, and you have noticed any combination of those neurological symptoms, the possibility of iron deficiency anemia is something your doctor needs to rule out with a simple blood test before attributing the cause to anything more serious. Treating iron deficiency anemia in an older adult who has been experiencing cognitive symptoms can, in many cases, produce a meaningful and measurable improvement in brain function. These are not irreversible changes. They are reversible consequences of a correctable deficiency. However, they will not be corrected if nobody looks for them, and nobody will look for them if the nail sign that might have prompted the search goes completely unnoticed. Sign 4 is the disappearing lunula and what your nervous system is losing. This is the sign I promised you, and it is the one I want you to check right now while we are talking. Look at the base of your thumb, just above the cuticle where the nail begins. Do you see a pale, whitish, crescent-shaped arc, like a small half-moon sitting at the very base of your nail? That is your lunula. It is the visible portion of your nail matrix, the living zone where new nail is being actively produced right now as you watch. In a healthy adult, the lunula should be clearly visible on both thumbs, typically visible on the index fingers, often visible on the middle fingers, less reliably visible on the ring fingers, and almost never visible on the pinkies. That layout is completely normal. Now, here is what I need you to examine more carefully. Is your lunula still clearly visible on your thumbs, or has it shrunk back beneath the cuticle and become invisible? Can you still see it on your index fingers, or has it become a faint suggestion of white rather than a clear crescent? The gradual disappearance of the lunula, a process known as an absent lunula or nail matrix atrophy, has been well documented in medical literature in association with several serious systemic conditions. But the one that most directly concerns me as a neurologist, and the one that is almost never discussed in the context of nail health, is vitamin B12 deficiency and its downstream consequence: subacute combined degeneration of the spinal cord. I recognize that this is a phrase most people have never heard before, so let me explain it simply. Vitamin B12 is one of the most critically important nutrients for your nervous system. It is essential for myelin production, the exact same protective coating I mentioned earlier regarding iron. Without adequate B12, the myelin that sheathes your spinal cord and your peripheral nerves begins to degrade. This process of subacute combined degeneration can cause symptoms including numbness and tingling in the hands and feet, difficulty with balance and coordination, muscle weakness, cognitive changes like memory disruption, and in advanced cases, serious and sometimes irreversible spinal cord damage. What makes B12 deficiency particularly dangerous in adults over 60 is that it often develops slowly, silently, and for reasons that are metabolic rather than dietary. After age 60, the stomach lining naturally produces less intrinsic factor, which is a protein essential for absorbing B12 from your food. Furthermore, many common medications taken by older adults, including metformin for diabetes and proton pump inhibitors for acid reflux, reduce B12 absorption even further. The result is that a massive segment of the over 60 population is B12 deficient without ever knowing it, simply because routine blood panels do not automatically include B12 levels in many clinical settings. Because the nail matrix is one of the most metabolically active tissues in the body, it shows the consequences of this deficiency early, sometimes years before the neurological symptoms become unmistakable. The lunula shrinks as the nail matrix, no longer receiving the nutrients it needs to maintain its full productive activity, retreats back under the cuticle. A patient I will call Evelyn, a 73-year-old retired school teacher, came to me after her family became concerned about what they described as her slipping memory. She was forgetting recent conversations, she was occasionally unsteady on her feet, and her hands tingled at night. Her neurological examination revealed a reduced vibration sense in her lower limbs, which is a classic early finding in subacute combined degeneration. When I looked at her hands, both of her lunulas had completely disappeared, and she had no recollection of when she had last seen them. Her blood work revealed a critically low B12 level. She had been taking a proton pump inhibitor for nearly a decade, and her dietary intake of B12 was minimal. With high-dose B12 supplementation, delivered initially as injections because her oral absorption was so severely compromised, her symptoms improved meaningfully over the following months. Her balance returned largely to normal, her memory fog lifted substantially, and her lunulas, while they never fully recovered to their earlier prominence, began to reappear at the base of both thumbs within 3 months. That outcome was entirely possible because we caught it, and the very first thread I pulled was the disappearance of her lunula. If you are still watching and this is helping you, type the number 4 in the comments. And if you haven't subscribed yet, hit that button and the notification bell so you don't miss any of our future videos. We have covered 4 major signs. Now, let me give you the clearest possible action plan to use today. Take your hands to a window with clear, natural daylight and examine each nail. Hold both hands side by side and compare the overall texture, quality, and appearance. Note whether one hand looks noticeably different from the other, and pair that observation with any changes you may have noticed recently in your sense of smell, your handwriting, or your sleep. Look closely for any horizontal grooves crossing the width of the nails. Check the shape from the side to see if any nail has begun to turn concave. Finally, look closely at the base of your thumbs and index fingers for your lunulas. Next, take a photograph of both hands. Make sure the light is even and the shot is close enough that you can see the nail bases clearly. Date the photo and save it somewhere secure. You will want to find it again later. This week, if any of today's 4 signs matched what you found on your own hands, write it down specifically. Record which sign you saw, which finger it was on, how long you have noticed it, and any other symptoms, such as numbness, tingling, fatigue, memory fog, leg cramps, or balance issues that have been present alongside it within the last 30 days. If you found 2 or more of these signs, or even just one sign combined with neurological symptoms, do not wait for your annual physical. Call your doctor's office this week. Tell them you want your B12 level checked, a complete blood count including iron studies, and a basic metabolic panel to evaluate kidney function. Ask specifically for a neurological screen if any of your symptoms involve your hands, your feet, your balance, or your cognition. The most important thing I can tell you is this: none of these nail signs constitutes a diagnosis on its own. Every single one of them requires clinical context. Your full medical history, your medications, your other symptoms, and a proper physical examination by your doctor. What these signs offer is a prompt. They provide a reason to have a conversation you might not have had otherwise. They are a thread worth pulling. The neurological conditions I have described today, early Parkinson's, chronic kidney disease, iron deficiency with cognitive impact, and B12-related spinal cord and brain dysfunction share one critical characteristic. They are all dramatically more treatable when found early rather than late. They are all conditions where early detection is entirely possible, provided someone knows what to look for. Now, you know what to look for. Your body has been your most loyal companion for 6 decades or more. It has been communicating with you constantly through symptoms, through sensations, and through signs on the surface of your skin and nails that most people are simply never taught to read. The nails you glanced at this morning without a second thought may well be the most honest diagnostic window your body has given you all year. You just needed the vocabulary to understand what they were saying. I want to hear from you in the comments below. Tell me whether your lunulas are visible on both thumbs right now, and share one symptom you have been quietly dismissing over the past year that you might reconsider after what we covered today. I read every single comment, and I respond to as many as I possibly can. If this video helped you, please share it. Not for the algorithm, but for someone you know who is over 60 and whose nails have been telling a story they have not yet learned to read. Subscribe to the channel if you want to keep receiving this kind of content. What we are building here together is a community of adults who refuse to accept that essential health information is only available inside a doctor's office. It belongs with you, right where you are. I will see you in the next video.